Hi, everyone. Thanks for joining us today. My name is Vidya. I'm a volunteer with Fertility Matters, and we're here with Jodi Munroe, who's a counselor. I'll let her do a more thorough introduction of herself. But this is part of the Figuring Out Fertility series, and today we're talking about mental health and infertility. So Jodi, do you want to take us away and get us started? And I'll pop in with questions from the audience. If you have any questions and are watching, please just shoot them over on Facebook in the comment section, and we'll try to get to as many as we can. Thanks.
Thank you, Vidya. So yeah, my name is Jodi Munroe. I'm a social worker. I do fertility counseling. I've been a social worker for many years and transitioned over to being a fertility counselor after facing my own fertility challenges with my partner. So today I'm going to talk about some issues with mental health, how to deal with the fertility issues with mental health, as well as also from the perspective of a person of color as well. Okay, so to get started, so one of the things I think one of the challenges with fertility treatment is that we need to make mental health a priority. Sometimes mental health gets overlooked when the focus is on the medical perspective. So, for example, people need to focus on the present, making mental health a priority, as well as I think right now with COVID, it presents a new challenge that we may have not been presented with before. So there's been delayed treatment. People are facing a lot of stressors at home, working from home, loss of jobs, financial stress, all of that. So I think seeking professional counseling and support is very important. And I know Fertility Matters, for example, they do have support groups as well, so that might be a benefit to some people. As well as some of the clinics are doing a very good job about offering counseling to their patients up front. I'm finding oftentimes clients are coming to me after they've already gone through failed treatment, or they're at the point now where they're seeking third-party reproductive services. So they've already had maybe several losses, they've had many stressors, they've transferred from clinic to clinic. So by the time I may see them, they have already been through a lot of trauma, maybe, and now they're seeking support. So it'd be nice for people to have some of that counseling up front, and some clinics are really doing that piece.
So you mentioned COVID and how it has impacted a lot of people who are seeking treatment. Can you expand on that a little bit? How do you feel COVID-19 has impacted seeking treatment?
I think a lot of it is the delay. So there's been people who were right in the middle of treatment, and when everything shut down, people were scrambling, trying to figure out what's going to happen. Even now that some of the clinics have reopened, there's a lot of uncertainty. And with borders being closed as well, we're seeing patients who are not able to maybe continue with their surrogacy agreement or a donation and things of that nature. So there's been a delay in a lot of that. I believe now that the clinics have reopened, some of that's being caught up. Patients are being seen. And I think people are more able to continue with their journeys at this point. Yeah,
which is great, because I know that for many, any kind of forced break is very difficult to handle, and when it's a forced break without any understanding of when you can get back to it, that's an additional level of stress. So what supports are available to people who are seeking support throughout their fertility journey?
So I think really depending on which clinic somebody's dealing with, some of the clinics are pointing people in the direction of counseling, for example, or for example, like yoga, meditation, acupuncture, some of those other services, naturopathic medicine, some of those other supports that are available. I feel like the clinics are referring people for those services, and some people are seeking out the service on their own. And they're joining groups, and I know Fertility Matters has some groups that they're running as well for support. And I think people are looking at podcasts, social media, and those things to find that support.
What do you feel are some of the barriers to seeking counseling?
I think some of the barriers that I'm seeing, like people will say to me, some of it's shame, and some of it's just access. So, for example, finances might be an issue. So, with COVID-19, for example, there are a lot of people who have lost jobs, they've been laid off from work, even their fertility treatment's been delayed. Even with the clinics resuming, they haven't been able to financially catch up because they've been off work and they can't afford their treatment. So, I think finances can be a huge barrier for people. Not only for treatment, but for counseling as well. So, for example, if somebody's lost their job and they had benefits and counseling was something that was covered by their benefits, that may no longer be available to them.
Yeah, that would be really difficult. We spoke offline about other barriers, such as, there's a lot going on in the world right now about people of color and access to healthcare. So are you able to talk at all about how being a person of color could affect your mental health well-being throughout this journey?
I think really right now with everything that's happening with like the Black Lives Matter movement and all of that that's in the media, it adds another layer for people. I think people are really having a hard time with maybe past traumas that they've experienced. Maybe they've had experiences with clinics where they've walked into a clinic and they haven't seen anybody that they can identify with. And also, I think it's difficult sometimes for people people of color when they're looking at fertility as being a challenge and not having anyone to identify with, or maybe walking to a clinic where assumptions are being made about their fertility without any investigations happening. So I think that's some of the challenges that people are facing. And I don't know how much our Canadian clinics are collecting stats for people of color. So for example, one of the barriers I'm seeing is that for people of color, and maybe different ethnic groups too, not necessarily people of color, but different ethnic groups who are looking for egg donation, for example, it's very hard sometimes to find a match.
Yeah.
And I know like across, maybe say we look to the US, there's some clinics that are specifically catering maybe or trying to bring in more donors that, like more ethnic diverse donors that can service those clients. So I think that's one of the barriers as well.
Definitely. I think that in my own journey, we kind of experienced that a little bit as well, where, I was in a conversation with a physician and the whole topic of race came up and it was like, race shouldn't matter. I'm like, but it absolutely does matter. Like, you want to be able to see yourself and your child, both like personality wise and also sometimes physically. And if that option isn't available to you, it feels really disheartening.
Yeah, and I think that's something that I'm seeing, even for example, like going into a clinic myself, like having my own experience and being told, well, you can, like giving a list of other cultures that you can maybe draw from if egg donation is the route. This is what's available. So knowing that, this is maybe not the option that we would want to take, but this is what's being offered. So trying to expand that, I think maybe in Canada we need to expand our donor base, and I think part of it is maybe to expand the search for more ethnically diverse donors and surrogates as well. But I know that even for surrogacy, there's a long wait for everybody. So that might be a tall order, but that would be the wish, right? Is to have more diversity in all those areas.
Yeah, definitely. So do you have any advice specifically for people of color who are facing those barriers?
I think really part of the issue with people of color is that there's like a stigma maybe, and maybe not being open about talking about things. Every culture is a little bit different. So being willing to talk about it, even when it comes to, for example, losses like miscarriage, grief, all of that, being open, I think is one of the things I would say is important. An example, I know I was reading an article about a church in the US where the minister actually approached his congregation because someone in the congregation who wanted an egg donor could not find anybody who couldn't find a match. So he actually went to the congregation in the church, which is a very open approach to say, this is a problem and this is what we need. Can anybody help this family? So I think being open to having the discussion is very important. I think there's probably years of stigma and just not talking, and that's part of the problem.
Yeah, absolutely. I can say, like, in my own journey as well, in the beginning, you know, everyone's kind of quiet in the beginning. They're confused. They don't know why they're not getting pregnant. It's a very lonely and isolating time. And for me in my journey, like when I started opening up more about it, I was able to kind of deal with it a little more. I think culturally for me, I found it difficult to open up, especially to family members, because you just don't talk about fertility in our culture. It's
Right.
just a totally taboo topic. And I know it's not, you know, isolated to people of culture or people of color or certain cultures. Everyone, the whole world kind of has that stigma around fertility. So what advice do you have for people who want to open up but just feel like they don't have anyone to do that to?
Right. So I would say, so for example, if somebody doesn't have like friends or family, some people like that anonymity. So they would say, okay, I'll go to a support group, or I will seek counseling. And I think that if you can't talk about friends or family, then you have those outside avenues that you can look to.
Yeah.
And then I think some people, as opposed to suffering in silence, maybe reaching out to an organization like Fertility Matters, who can, you know, point them in the right direction, or even if they're still working, maybe their employee assistance program can point them in the direction of counseling where cost is not a barrier.
Yeah, definitely start with Fertility Matters.
yeah. And I think really, like, some people too, they not necessarily want to do a group. Maybe they're nervous about speaking in front of other people or things of that nature. But there are a lot of resources out there, and not to kind of suffer alone.
Yeah. We have a great question from a viewer asking, do you have any recommendations for podcasts to listen to throughout the journey?
Not specific ones that I wouldn't necessarily promote today, but there are quite a few. And if that person wants, I can send them an email with the list that I've had. I don't have it on my hand right now, but there are quite a few out there. Mm-hmm.
I think if you can comment on the thread on Facebook, that would probably be great, because everyone who watches the video can see it.
Yeah, I can post up the list. I do have a list of the podcasts. I can post those.
Perfect, thank you. We have another question that's come in that says, how can you maintain a strong relationship with your partner or spouse throughout infertility?
I would say with that question, it's really about communication. Because I think sometimes two people can be in a house together, but they're not necessarily having those tough conversations. So I think that the people need to keep their communication lines open. And if they're having difficulty, then that's maybe when they need to seek a third party to maybe have some of those tough conversations, because often couples are not on the same page. Somebody may want to continue with treatment, for example, and the other person may want to not to continue with the treatment or go a different route. So trying to get on the same page can be often difficult. And sometimes people are having trouble having those conversations. So I would say that'd be a good situation where somebody would seek that outside intervention.
Definitely. Do you have any advice for just day-to-day trying to have those conversations with your partner as well?
So some people, I think they would show their feelings towards the other person in different ways. So some people are good with verbal communication, some people are better with written. And I've had a client come to me where they've actually written what their wishes are, or what they would like to do going forward, because they didn't have the comfort level to open the conversation. So they've actually written it in like a written form. And that might work for some people, that might not work for everyone. But I think sometimes you have to kind of know the person that you're communicating with and what's their style of communication, and try to meet them on their level on what works for them too.
Yeah.
Yeah.
I love that advice. So my husband and I, when we first started dating, we used to have lots of written fights because I wasn't great at actually talking about my feelings at that point.
Yeah, and you think about like grade school, you write a note and you check a box and it's like, do you like me? Yes or no? And sometimes people have to bring it down to that level is where you're all nervous and you have to communicate in a very simplified way. And sometimes, it's that kind of thing.
Yeah. And these conversations that you have throughout infertility are very like heavy, complex conversations. So it is difficult to articulate your feelings all the time, and your feelings change day to day, hour to hour sometimes. So yeah, I love that. What recommendations do you have for someone who's trying to cope with anxiety or depression throughout fertility treatments?
So if somebody's already coping with anxiety and depression going into fertility, if they've never sought any type of counseling, I would say that that'd be a good option for them. There's often people who are already on, say, for example, I saw a client who's on medication for depression, and the concern is, can I continue with my antidepressant while I'm doing fertility treatment? So in those situations, I say, you need to go back to your prescribing doctor to see, to let them know this is where you're headed and what your plans are. And then also be very upfront with your reproductive endocrinologist to say, I'm on this medication. I'm coming to you with anxiety already. And some people are very good about giving that information. And I know a lot of the clinics in their initial intake, they will ask some of those important questions. So that might be documented already, that this person's coming in, they're already anxious, or they already suffer with depression, or they're on medication for these things. And then they have a better understanding of how to proceed with that treatment. But I think if somebody's already feeling anxious in that they need that support right from the beginning, as opposed to kind of starting the journey and then finding challenges in receiving appointments, or like the day-to-day challenges of going through the journey, and then they're struggling. It's kind of to try to hit it head on at the very beginning.
So if you didn't hit it head on in the very beginning and you're in the middle of treatments and maybe you have like undiagnosed depression or undiagnosed anxiety, but you're having those feelings, what's your advice for someone in that situation?
In that situation, I think they need to talk about it and be honest about where they're at. And there's no shame in that. I think people really need to be honest about where they are, because if they don't talk about it, things are going to get harder going forward, most likely. And it can become more stressful the longer you're in that journey, or the longer you're pursuing the fertility route. You're going to find more barriers going forward. So to be open about it.
Mm-hmm.
One of the things, I was just going to say, one of the things too, I find with people that I see, and I've known this for myself too, is that there's no shame in stopping your treatment, or maybe not necessarily stopping, but taking a break. Because there's going to be times where there's disappointments, there's going to be failed cycles, there's going to be things that don't work out. And it's important to know that you can take a break from it, or take a step back. And give yourself some time to kind of breathe, and then maybe start fresh again, or move forward.
I think that's like so hard for people going through this, because you feel like a break is wasted time, but there's so much you can gain from having some time away as well, including perspective and just what you need for your mental health to get through the next set of treatments.
Right. I think I've seen people too where their break necessarily, so for example, COVID was a forced break for people. But there are people sometimes where they've had maybe a bad experience with one clinic, and they want to start somewhere else, and they feel like they're going to delay by doing that. But for some people, that's beneficial for them. So to know that maybe that's what you need. It's not the worst thing that could happen.
Absolutely. Actually, I feel like I'm talking about myself a lot during this. Sorry, it's not my counseling session. But one of the best things that I found in my fertility journey, which lasted like 5 years in total, was we had to switch clinics because we needed a second opinion. And it was the best thing that could have happened to us, just finding a clinic that better fit with what we needed at that time, and finding a physician that was a better fit with what we needed at that time. So, but at the time we felt like distraught over the wasted time of, having to get in with another doctor and do that whole intake again and blah, 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 blah. But it was honestly it helped us end our journey more positively than it would have otherwise.
Yeah, so I think that's important for people to know that for sure. Yeah, that's an option. And I think even though there's a weight involved, and I think sometimes too, as women, the pressure for to have a positive outcome in the end is based on our age a lot of the time. So I think a lot of the pressure falls on the female partner in the relationship, or even when you're looking at, for example, same-sex couples, like it's, like this old adage, oh, the clock is ticking, the clock is ticking. But to know, maybe, for example, losing 2 or 3 months may give you if you think of it as a loss, but you're gonna maybe have a better outcome in the end.
Yeah, a small loss could be a very great gain.
Yeah, for sure.
We have another question from a viewer. How do you tell someone close to you that you aren't comfortable going to their baby shower? And do you have suggestions on dealing with pregnancy announcements on social media? So 2 questions.
Okay. So I think, so I just can only talk from my own personal, maybe I'll talk from my personal perspective on the baby shower thing. I think there's been times where, I'll give an example. I've had a few miscarriages myself. So if I've had a miscarriage like last week, 2 weeks from now, I may not be able to go to my friend's baby shower, but it's not that I don't care for my friend or I don't love my friend. And maybe I don't need to let that friend know that's why I'm not coming. But just to kind of graciously decline, maybe you would send a gift, because you would have given a gift anyways. So that's my style. Like, I would just send a gift, or maybe have somebody drop it off for me, or drop it off myself, but maybe I wouldn't attend the baby shower. And I feel like if somebody's really truly your good friend, in the end, down in the future, maybe there's a time where you would tell them, oh, this is the reason why I ended up not going to your baby shower. But I feel like if it's your good friend, they're going to understand. And I think that they would, it's better to decline than to be at the baby shower and to have that, like, to have those bad feelings while you're there. I think it's better not to be present. And I think everybody's comfort level is different. Some people can go to the baby shower, smile, be okay, and then go home and be very devastated. And it's natural maybe to feel jealous when friends or family members are having babies, and you've been trying so hard and it hasn't happened for you. But that's natural to feel that way, and for people not to feel guilty about that, and not feel guilty to say no to something. And I think maybe sometimes, with COVID, now people are taking a step back more, where there's a lot of events that have been canceled, or a lot of disappointments, and people have had to learn how to deal with those disappointments. Whereas before, even myself, I'd be running to every event and doing all of these things. Now it's kind of, you're taking a step back, and you can't go to those things as you did before. And sorry, the second part of your question is
about handling pregnancy announcements on social media.
Okay. That was a tough one as well, but I feel like sometimes people need to take a break from social media. And it's easier said than done. I know we're very connected to our social media a lot of the time, but I think if you look back to times where we didn't have social media, a birth announcement might have been something, I'm dating myself now, but something in the newspaper, right? It's not, everything's so immediate, and I think we're being bombarded with a lot of messages that can affect our mental health. So I think really it's important sometimes to take a step back, and you don't always have to, like this announcement, you don't always have to be the one to say, oh, congratulations, or I'm so happy for you, or any of that. You don't necessarily have to you don't have to respond if you don't feel comfortable doing that. But I think sometimes people need to take a step back from social media.
Yeah. If that's what you need for your mental health, then that's what you need.
Yeah. And I think too, like, if you like examples of people, for example, like you might see some celebrities who are posting, oh, they're like 50 plus, and they just had a baby, and there's no talk about any of the background. It's just like, oh, they had this baby, everything's wonderful, but nobody knows their backstory. I think in the media, sometimes it's all like, everything's wonderful, everything's great, like this just happened, it's a miracle, but no one's telling their backstory. So I think now maybe a little bit more people are talking, and they're sharing more of what they've gone through or how they've gotten to where they are. And I think it's important for even like on social media for celebrities to be more open, and it's their own comfort, right? But I think it helps other people when people are very open about, like, this was an easy journey for me. Yeah, I have this baby, but I've had 5 miscarriages, or I've had IVF, or I've had a surrogate, or etc.
Yeah. There's a question here, but I think, just to paraphrase, I think it's around people or advice for friends, with friends of people who have infertility. So for instance, like, what advice do you have for someone who has good news to share, like they're pregnant but they're afraid to tell their friend who has infertility, or who just hasn't been able to get pregnant yet? How can that person break that news in a sensitive and kind way?
I think it's important just to be honest about it. Because on the flip side, I think when people don't tell the friend and they find out maybe from someone else, or the pregnant person is really far into their pregnancy and then they tell their friend quite far along, that friend might feel maybe offended, right? So I think it's good for that friend to be honest, and maybe also acknowledging at the same time that I know you're going through a rough time and you're really trying to get pregnant, or you're whatever the situation is, but that I wanted to let you know that I'm pregnant, and I don't want you to hear from anyone else, kind of thing. Yeah,
Definitely.
Eventually they're gonna know, right?
Yeah.
So it's better to kind of be upfront. I've had a friend who went through a donation and surrogacy and all of that, and knew that they were that twins were kind of imminent, and not telling until they're born. So it's tough for that person then to find out, well, how come you didn't tell me, right?
Yeah.
You didn't value my friendship enough to tell me, or my familial relationship enough to tell me, because you're afraid of how I would take that news. But you'd rather know at the same time.
Yeah. I think for me, I don't know if this is the same with everyone, but my preference was, if you're going to tell me you're pregnant, please just tell me privately, because I don't want to have to kind of handle that news in front of lots of other people who are looking at me, knowing what we're going through, and then also like waiting to see how I would react. Like, either like text me so I can deal with it emotionally on my own, and then I'll call you when I'm ready, or tell me in a private conversation. But please don't tell me in a group at a baby shower that I was already worried about going to in the first place.
Right. Yeah. Because then you're really conscious of everybody's watching you. What's your reaction going to be? And yeah.
And they might not.
Like everyone's on eggshells.
Yeah.
Mm-hmm. Yeah.
It's possible that nobody's watching you and everyone is just like, excited by news, but it feels like everyone's watching you when you're dealing with infertility.
For sure. Mm-hmm.
Do you have any advice for letting friendships go? I know that, in speaking with people who are dealing with infertility, they find that some of the friendships that they used to rely on for other big things in their lives aren't giving them what they need throughout infertility. So how's the right way to approach that?
I think sometimes friendships are based on, sometimes it's history, sometimes it's common interests, it's activities. And I think friendships change over time. And maybe necessarily they may let the friendship go, because you can be friends with somebody now because you were playing, I don't know, you're playing baseball with them. But when you're going through this journey, you lose interest in that activity, and you maybe don't want to do that sport anymore. So your friendship changes. And I think sometimes friendships kind of end naturally. I don't know that you have to call the person and say, I'm not friends with you anymore. Like how, I think of, oh, I'm not your friend anymore one day. Like how little kids will say, oh, I'm not your friend. And the next day they're friends again. It's sometimes things happen over time naturally. I don't know that friendships need to end over fertility, but I think people do lose some relationships. And it's a natural progression, and people are at different points in their lives. I know for me, for example, I had my daughter quite late, and my friends have kids that are going into university. And it's friends that are all different stages of life. So I think you have friends that are different levels of closeness as well. So, but I feel if there's somebody in your life who is toxic, I'm not sure if this is what this person's question is about. If you have somebody who's really, you feel like the relationship is not beneficial to you and it's causing you some kind of mental distress, sometimes you have to let those relationships go and be comfortable knowing that you're doing what's best for you mentally. And sometimes it's just about having boundaries with people as well.
Yeah, I love that. Setting boundaries is very important.
Boundaries.
It's something that I think women in particular find very difficult to do often. So
yeah, it's hard. Sometimes it's hard to tell somebody no, or it's hard to let some of those relationships go. Or it's difficult. Sometimes connections are even family connections, right? There's some family relationships where if it's causing you more distress, then you maybe have to take a step back.
Yeah.
Yeah.
Do you have any like parting words you'd like to leave with our viewers and the people who'll be watching this video later?
I guess really some of the things that I've seen is that, people will say that maybe stress is causing somebody's infertility, but I feel like infertility maybe sometimes is causing the stress. So not to suffer alone and to seek that support, whatever that support is that you feel that would work for you. So if that's seeking professional support, group, reaching out to an organization, looking at podcasts, I think that it's very important to have those conversations in some way or reach out to somebody and not to suffer alone. And to know that you're not alone in what you're feeling, because there are a lot of people out there that are kind of in a similar situation to you. Not everyone's journey is exactly the same, but there are often a lot of similarities, and kind of surrounding yourself with people that can understand and that you can relate to, or that maybe they don't exactly understand, but they can say, I'm here for you. If you need to cry, you need to yell, you want to tell me about your disappointment, I'm here to listen to you. Keep those people around you, because those are the people that you need to have in your life, and to kind of focus on your own mental health and seeking that support.
Great. What a great way to close up. So thank you so much, Jodi, for joining us. For everyone, Jodi is from Ray of Hope Consulting. So please check out her website and reach out to her if you feel like you are in need of help. And again, we will, this is part of the Figuring Out Fertility series. Fertility Matters Canada loves to bring you tons of informative information through these Facebook Lives, and also through our Facebook page and all of our social media feeds. So please check us out if you haven't already. And as you may know, we are a not-for-profit organization and rely on the donations of the public. So if you are in a position that you can do so, please click on the donate button on our Facebook page and help continue this conversation. So thank you so much, Jodi, for joining us. I hope we can speak with you soon.
Thank you so much. Thank you for having me. Thank you to Fertility Matters. And I feel like, honestly, you guys are doing amazing work. And I feel like when I was going through my own journey, I didn't necessarily seek support because I'm a therapist. So I thought, oh, I've got it handled. My partner as well, he's a psychologist, so we've got it handled. But even the professionals don't have all the answers, and we need support too. And I think even people need to maybe look at their clinics too, and the doctors in their clinic, that they don't always have all the answers, and that they need support too, and to kind of go easy on them, especially now with everybody reopening. So that's my last thing. Yeah, I think it's been a tough time for everybody, I think, really. Yeah. So thank you guys for the work that you're doing. It's so much needed that we have you guys and keep your support going. Yeah.
Oh, thank you so much. And I'm sure the work you're doing for people is also super important. So if you're in a position where you feel like you need support, please reach out and find that support, because it's so important.
For sure. Okay.
Okay. Thank you.
Okay.